Welcome everybody. I am Kim from Sheppard Health and Wellness and Embrace Life. This is a big topic when it comes to PCOS. It's one of the things that I support many women with clinically. So it's one of my big passions, and I've actually written pages of notes, which I know I won't have enough time to go through them all. So I'm going to pick out the parts that I'm really drawn to, give you a bit of that insight and to give you a greater understanding of PCOS as well. So thank you for all of you who are watching live, and thank you for all of you who will be watching this back in your own time as well. When it comes to PCOS, it's not just a case of there being one particular type of condition or very specific symptoms that everyone experiences the same way. You might actually have PCO, so the polycystic ovaries, or the PCOS, so the polycystic ovarian syndrome, or you can have the AE-PCOS, so that's the androgen excess. It's more of those masculine hormones that are being released, and they can produce some of those more masculine symptoms, which might be a bit of the extra hair growth and so forth. So there are a few different variations. Essentially, to have a diagnosis, you've got to have at least 8 of the symptoms. And clinically, what I usually see is it's when women are trying to have a baby, and that's when they usually find out the diagnosis of PCOS. So I see a lot of women on this fertility journey of discovering that it's not as easy to conceive as they would have wished, hoped, and planned for. But one of the reasons why it doesn't usually get diagnosed until the age of trying to conceive is a lot of the times the younger generation, so when they first get their period and they're teenagers, they have these really horrible periods, so it's painful and it's heavy and they're moody and they've got the acne going on, so there's lots of different things happening. They get prescribed the oral contraceptive pill or the combined oral contraceptive pill, which suppresses the symptoms really well. But unfortunately what happens, and what I've seen clinically, is that once women decide that they want to have a baby and they stop taking the pill, either they have the return of those horrible periods, or they discovered that they actually don't have any periods now. So my job then is to actually get their body healthy enough and bring it back into balance so they can actually have a regular period as well. So I've written down, like I said, a whole bunch of different notes, but to give you a bit of an insight as to how common this is. And even personally, my GP's discussed with me about going to be diagnosed with PCOS, but then I ended up just treating myself naturally with a whole bunch of stuff, and I'm going to give you a bit of support here as well, because it's a case of, it's something that like I said, I'm passionate about, something I'm really good at. I love helping people discover that periods do not have to hurt. We should be waking up and be going, oh my gosh, I've got my period, rather than having to suffer and to take time off work. And I love helping people to have babies as well. And by doing my part in helping you to conceive, it actually also helps to increase the chances of passing on healthier genes as well to your baby. So something, like I said, super passionate about. But when it comes to PCOS, I'm just going to use the general term. Back in the 1990s, worldwide, there's about 1 to 10 or 1 in 15 women were experiencing or being diagnosed with PCOS. In 2003 worldwide, it was 1 in 7. And then these days, it's about 21% of women who are affected by PCOS. So we're somewhere between the 1 in 5, 1 in 4. But about 70% of those women actually aren't even diagnosed. So they're just thinking that, hey, this is what your period's meant to be like, and they just suffer through it. They take pain medications, they take time off work. So a lot of women, which could even be like myself, haven't been diagnosed with it. But like I said, I like to go in there and balance the hormones and teach people how to have a very holistic approach on how to regulate your hormones. And that means then, usually for most women I see, 3 to 4 months of regulating hormones makes a dramatic difference, where I wake up and discover that I have my period and haven't had to suffer through it at all. So tonight's topic will be primarily all the naturopathic stuff that I do. So for those of you who haven't watched any of my webinars before, I am also a yoga teacher, so I very much have an Ayurvedic approach to medicine as well. I'm a Reiki master. I do flower essences, I work with crystals, so I like to have a very holistic approach. I like to look at every area of your life, and I combine the science and the intuition to really validate those intuitive hits that I get as well. So I back up that with my questioning, with my science background, with my Bachelor of Health Science as a naturopath. So PCOS is a complex endocrine and metabolic disorder. So basically it's a hormonal disorder, and it's really it affects the metabolism as well. There can be the presence of an increased male hormone. So naturally we do have male hormones in us as well, like testosterone, but it's when there's the imbalance, we have too much of it, that might be one of those AE PCOS type symptoms. There can be irregular ovulation or menstruation. So it might be that you're not actually ovulating every month. It might be that you've got one ovary heavily affected and the other one's relatively healthy. So you might be ovulating every second month. You might have a period every second month as well, or you could still have a period every month, but you're just not ovulating every month. It affects the HPA axis. That's the hypothalamus, the pituitary, and the adrenal glands. So when it comes to PCOS, it is not just your reproductive system, it's systemic. And so I'll give you a bit more insight as to how systemic it is later on as well. It can also affect the thyroid, and I have met many women with PCOS who also have thyroid conditions. Most commonly, it's an underactive thyroid, so hypothyroidism, but it can also present with an overactive, so hyperthyroidism as well. And there can be an infrequency in cycles. So I've seen some women have cycles every month, but there might be some women who have a 3-week period, then they don't have a period for 65 days, and then they have a monthly period, and it can be all over the place. There may be the hirsutism, so that's the hair growth. There can also be acne or obesity. In saying that, I have met a lot of women with PCOS or PCOS style symptoms that do not have obesity. I have referred a few of them off to have the diagnosis if that's what they're after by their GP. Otherwise, I go in and focus on balancing their hormones. There can be insulin resistance, hyperinsulinemia, so high insulin within the blood, dyslipidemia, so this also affects the fat cells as well. So if you have high insulin, that's going to affect the ovary. So that metabolic symptoms, this is all of their digestive system, it's working with the pancreas. We need to make sure that your blood sugar levels are regulated. So it can affect the metabolism. There can also be type 2 diabetes associated, an increased risk of cardiovascular disease. So the other thing that does increase the risk of cardiovascular disease as well are the drugs that are used, so like the oral contraceptive pill. Even though it suppresses the symptoms really well, it's not an actual cure. And long-term being on the pill for a long time can actually increase a few risks with your health as well. Ideally, you want to be able to get your menstrual cycle as regular as possible. Ideally, you want to be having at least 8 menstrual cycles a year. That keeps the endometrium really healthy as well, so that lowers the risk of endometrial cancer. So a lot of women, and this is women that I've met for the last 20 years, and even still some patients, they get so used to just suppressing their periods because they're just horrible. So they just skip their pills, or skip the period and keep taking the pills. So long term, it's really not healthy. Like I said, you want to be having your periods as regularly as possible. Ideally, having a period every month, but at least not skipping more than 4. I'd never recommend anyone to skip their period anyway. It's not healthy. It's something that the body's meant to be releasing. But then it's also up to the woman as to, it's their body and it's their choice. So I don't judge them for that either. There is, so with the PCOS, we're talking about the polycystic ovarian syndrome. So there's predominantly a lot of cysts on the ovaries. Now, you can have PCOS and not have cysts on the ovaries as well, which is why there is such a broad, there's such a broad array of signs and symptoms that can be presented, but one woman will not present the same way as the next woman. So you may have cysts on your ovaries or you may not. Often it does begin in those early teenage years I was talking about, when they first get their periods and they're feeling horrible. So I like to get the word out there that once I've regulated one woman's cycles, just to let them know, like when they decide to have children one day, make sure their daughter's got a healthy menstrual cycle, and becoming familiar with our cycle as well, because people have suffered through them, they may see it as a burden and it's not a joy in life, but to have your period is an absolute blessing. And ideally, our period will also fall into that cycle of the moon as well. So you could refer to it as your moon cycle. We have a 28-day period ideally, and we've got that 28-day moon cycle as well. And I can tell that when my period is in flow, I'm going to link up to either the full moon or the new moon. If it starts to fall out of that, then I know the period's getting a little bit longer. So rather than being 28 days, it could be 29, 30 days. And I know to balance my hormones and to bring them back into balance again. The other, I'll just I'm going to narrow it down because I can tell I'm always halfway through this already. So there's a few risk factors involved. It can be that it is genetic. It could also be that it's to do with drugs used for epilepsy or bipolar disorder. So those drugs could actually be contributing to PCOS being diagnosed. There is also an association between low birth weight and also a history of early puberty as well. So most women I meet, the average woman probably gets their cycle around about the age of 13. I do meet many women who don't get their cycle to about 15, but they could be like myself, and I got them when I was 11, but I've met women who have been 10 and 9 who've even gotten their cycle. So we don't want to be hitting puberty too young. Not that there's a lot of control within that, but if we keep everything in life balanced, that means things aren't going to speed up as well, but that's a whole nother discussion. And if there's any androgen exposure, so these are the male hormones as well, if we have an exposure of these in utero, so when we're actually within the womb, and that can come from the mother, the placenta, or the adrenal glands as well, because they pump out that cortisol, that stress response. So 90% of women have irregular periods, 70% suffer from anovulation or infertility. So it might find that they're not actually regularly having a period, or they discover that it's not as easy to conceive. So it doesn't have to be complete infertility, but it might be subfertility. 50 to 70% have insulin resistance. So you'll find that there's probably a high sugar craving if you have the insulin resistance. 70% can experience the hair growth. 40% can be overweight, but that number could be totally different again. As in this research is from about 2011, was it 2014? It's at least 7 years old anyway, which means that with the amount of women being diagnosed these days, and a lot of the women that I do see aren't overweight at all, so that figure could be a little bit different. 1 in 3 have abnormal bleeding patterns. 15% report cyclical basal body temperature changes, so they might find that the body is particularly hot. Usually it's their body feels like it's overheating a little bit more. And they rarely develop a deeper voice or necessarily have those changes in body shape either. So there's a whole bunch of different hormones that are involved with PCOS. And to briefly state them, we've got luteinizing hormone, follicle stimulating hormone. There's a whole bunch of different types of estrogen hormones, cortisol, prolactin, testosterone, insulin. So I love it when women bring in their blood test results to me. Usually when you go to the GP, they're going to check a whole bunch of different blood tests. If you ever can't get them requested, I can always request them for you. But I always encourage people to bring in their blood test results, because PCOS is essentially a potential dysfunction of the pituitary, the adrenals, the ovaries, the pancreas, the skin, liver, skeletal muscle, fat metabolism, and genetics. So from head to toe, the body in some way may be affected. So if you want to grab pen and paper, or if you're watching this back, hit pause. These are a bunch of tests that you can have requested via your GP. If you get them done through your GP, they should be free. The GP should be able to claim them against Medicare. If I request them for you, I can do that, but you just have to pay the lab directly. So we want to check all the different types of estrogen. So it's E1, E2, and E3. FSH, so that's your follicle stimulating hormone. LH, I'm just going to go through them all because there's a lot. Prolactin, progesterone. Now, if you're going to check that one, ideally doing that 7 days prior to your actual period. The other ones, getting them done on about day 2 or 3 is ideal. FAI, so that's to do with your androgen hormone. SHBG, it's one of your sex hormones. Free and total testosterone. DHEAs. You could also do a glucose tolerance test. AMH, full thyroid panel. Every GP I've met can't actually request a full thyroid panel without the TSH being out of range. Generally, they will check TSH and maybe free T4, I think it is. But unless they're out of range, then they can't actually request the other ones, but I can always get them requested and ordered for you. Blood lipids, such as cholesterols. And you could, quite often a GP will request a pelvic ultrasound as well to see if there are any cysts on the ovaries. So that's a whole range of blood test results. So if you do have any of those, I do recommend you bring them in. Now, there's also a whole bunch of natural medicine that can have a beautiful effect on the body. So when it comes to natural medicine, it's not about suppressing the symptoms, but it's actually about nourishing the body and giving it all of the nutrients and the sustenance and the minerals and the vitamins it needs to be able to restore the natural function of the body. So one of my favorite herbs that I love to work with is peony. It's one of my PCOS herbs, I refer to it as, because that helps to regulate a few hormones. So the pituitary hormones, helps to increase ovulation, helps to balance the hormonal irregularities and increase progesterone. Another sign of progesterone is low is that you'll find at the beginning of your menstrual cycle, you might have a little bit of that brown discharge before your period actually kicks in. So that could be a sign of low progesterone. If there's a history of miscarriages early on as well, that could also be a sign of low progesterone. If there's low progesterone, you may not necessarily be ovulating either. We ovulate from one side at a time, and we will actually have a gland that swells up on one side of the body if we are ovulating. It takes a bit of practice getting used to, but that is just one of the other signs to confirm ovulation. So we really want to make sure those progesterone levels are at a sufficient level. The other thing to be really mindful of, which is why I always give the advice to make sure you don't self-prescribe, is because there are many natural medicines that should not be taken with pharmaceutical drugs. So I use a system, plus my years of study and clinical experience as well, is to make sure that anything I prescribe is not contraindicated with anything else that you're currently taking, whether it is natural medicine or pharmaceutical drugs. Sometimes you need to take things apart because they can prevent the absorption of something. It might also be a case that you need to take it at a certain time of it during the day for it to have a better effect on the body. When it comes to PCOS, we might be taking things at a certain time of the month as well. So there's lots of things to be very mindful of to make sure that you're doing it safe. And I have met many people who do self-prescribe because they're trying their best, but they might also be wasting their money as well because they're taking the wrong things, which is going against the healing process, or it's actually very unsafe with medication that they're taking. So I always like to say, come in, let me cross-check to make sure that we're doing this safely for you. Then licorice is a beautiful herb as well. So licorice again, so one of the reasons I was saying be very mindful about certain natural medicines that you take. If someone has high blood pressure, I won't prescribe them licorice because it can naturally increase the blood pressure. Now this licorice is not the same as eating the lolly or the candy licorice that actually doesn't have any licorice in it. But this is the beautiful herb licorice. So I like to use that one when people actually don't mind the taste of licorice. It's a nice little complement to add into the herbal tinctures. That one's also great for reducing body fat mass. So if there is any of that excess weight that's needing to be shifted. Saw palmetto, this is a beautiful male herb usually. So this one helps to balance the androgen, the male hormones. And then quite often I'll see women that because they've got the blood sugar irregularities, they're being prescribed the metformin. So there is some beautiful herbs like galega that help. It's like a natural version of metformin. Metformin is a synthetic drug, whereas galega is a natural alternative. So there are heaps of herbs that I work with, and I've always got a huge stock within my dispensary of the PCOS style herbs. So things that you can do at home to support regulating your hormones. Now, avoiding phytoestrogens or xenoestrogens is probably a better word to use. So we want to avoid synthetic forms of estrogen. So for instance, don't microwave your meals in plastic. It leaks these xenoestrogens, so they mimic estrogen in the body. So anything, even if you have a water bottle that's left in the car and it goes hot, don't drink from it. Go get a cup of water, go buy another reusable bottle or something like that. So avoid having plastic being heated and then consuming foods or drink from it. We want to increase fiber. So we need to get those bowels moving as well. Vegetarian diets actually are quite clinically evidence has shown that they can be quite successful in helping to get the metabolism under control. When it comes to a vegetarian diet, though, it's not about living off the simpler carbs, all those white carbs, like the white bread, the white pasta, the white rice. We actually want to go the other way to the brown stuff, but it's more about increasing all of the vegetables. We don't necessarily want to be consuming a ridiculous amount of fruit. It's more the veggies we really need to focus in on. And one of the goals, if needed, is to focus on weight loss as well. So when it comes to creating a treatment plan for someone, I always say to people, I want to create a treatment plan that doesn't put any pressure or stress in your life, because we need to have the right treatment plan for you. And what herb is working wonderfully for someone else is not necessarily indicated for the next person, because they might have other conditions. Their body might be expressing something else to me to let me know that this particular herb's not good for them. They might be taking medications. They might be breastfeeding. There's lots of things to consider. So we want to increase protein and a higher fat diet for a short period of time. Again, come and have a chat to me if you are wanting to do this, to make sure that you're doing it the safe way as well. We want to reduce those simplex carbohydrates, so the white sugar as well, so all the white foods, all the heavily processed foods. We want to eat regularly, so every 2 to 3 hours, and that'll help to maintain those blood sugar levels. But what is really important is we actually need to tap into the body's innate ability to communicate to you. So we need to recognize what our hunger signal is. So when we're going to snack, are we actually hungry? So we need to first check in and go, okay, do I actually feel any hunger pains? It's like, okay, no, I don't. All right, so am I hungry in this moment? It's like, not really. I'm kind of just bored, or I've just had a really stressful day at work, or I've had a really uncomfortable conversation with my partner. So we need to check in with what your body is actually conveying to you. And recognizing those cues, recognizing when you're full. So not going back for a second meal, not eating until you're absolutely chockers. We want to only eat to about 80% capacity, because it takes about 20 minutes for your stomach to message the brain to go, hang on, we're actually full, we can stop eating. So we need to recognize our body's unique language. We need to relearn that. We want to snack more on protein foods, so not snacking on sugars. Or fruit sugars, so eating more vegetables than fruit. But when it comes to snacks, protein snacks are usually a good option for women who have PCOS. And exercising. So if possible, moving the body daily. You want to get the heart rate up a little bit. So it only has to be 30 minutes. You don't need to be exercising for hours. And that might mean that you're going for a walk on your lunch break. Or it might mean that you go to a yoga class in the evenings, or it could be that you decide to do a few little exercises at home, or perhaps you like going to the gym. It doesn't have to be ridiculously exerting exercise. You want to get the heart rate up a little bit. So if you can aim for 30 minutes a day, and if you're not doing any exercise at the moment, I would start with 1 to 2 days a week and work your way up from there. There's lots of other herbs that I love to work with. Shatavari is a beautiful herb, not indicated for everybody, but for the women who I do use it for, it is a very female tonifying herb, so it helps to tonify the female body. So it's a beautiful herb. And then quite often there is nutritional deficiencies as well. So sometimes magnesium could be a deficiency. It might mean that we need to work with something like increasing chromium-rich foods to help with those blood sugar levels. So maybe snacking on some sunflower seeds or something like that. And the other thing that is quite often underlying when it comes to PCOS is that there quite often has been a traumatic event. And that could be a physical, a mental, or emotional trauma. Most women whom I probably have met clinically who've come to see me for PCOS support or fertility support, if their periods were horrendous as a child, they quite often had a very stressful childhood. Or it could be that I'm meeting a woman who, as an adult, she has pushed herself so hard, or perhaps she had a really horrible marriage breakdown. A physical trauma could be that even there was a car accident or something like that. So being mindful of how trauma can impact the body. You know, people might go through something and then think, yes, I've resolved that, I've sorted it out, but it might be 10, 15 years later when you're talking to someone like myself where we go, okay, so that's when the symptoms first presented for you, was when you went through that physically traumatizing event or that emotionally traumatizing event. So being very aware if you have experienced a trauma in your life. I've found flower essences are fantastic to help with shifting some of this emotional burden, particularly when you know what you need to do but you just can't do it. Flower essence is amazing, so quite often I'll mix up some flower essence blends to help people shift through that emotion. For PCOS, I quite often make beautiful herbal tinctures, so it's using the medicine of the earth, of the plants, to help to support the reproductive system, reduce stress. Perhaps we need to reduce those sugar cravings. We might need to lose a bit of weight, support the sleep, whatever it is that's happening in their world. I like to see the big picture. If I do need to refer someone for counselling support as well, I have found clinically a holistic counsellor has proven fantastic in helping people to shift through that on a deeper level again. Because I am a naturopath, I'm not a counsellor. So I know that when I'm needing that extra support, I will refer people to a holistic counsellor. Because even personally, I've found even one appointment with a holistic counsellor was life-changing compared to seeing a clinical psychologist for 6 sessions in a row. So from personal experience, holistic counsellors have been amazing. So that is half an hour already. As you can tell, it's something I'm super passionate about. I will create a code. Let me just grab a pen so I don't forget the code. So if you do want to go on this journey, whether it's to do with PCOS specifically, or perhaps you're trying for a baby, you haven't been diagnosed with PCOS, but you're struggling to conceive, I'm going to create a code for you. So that way, if you would like to come and see me for a bit of support, this code will get you 30% off your appointment. So the code is PCOS21. So if you quote that when booking your appointment, just get in touch with Embrace Life to book the appointment. Embrace Life number is 34916533. You can also book online at embracelife.net.au. Like I said earlier, from personal experience and when I've been supporting women as well, it might be that it's about 3 to 4 months of nourishing the hormones and working with maybe reducing stress in your life. It might be that we need to support your diet as well. So I'll create a treatment plan that feels realistic and achievable, because I can understand from everything I've just shared in the last half an hour, that might be really overwhelming to think, where do I even begin? Where do I start? There is so much information that it might seem almost impossible to be able to focus in on all that. So that's why I spend an hour in the initial appointment and I'll ask you a bunch of questions. I'll ask you about your diet, your lifestyle, your sleep, your relationships, what medications you take, what vitamins you take. I'll look at your job, your hobbies that you have. I like to look at the big picture, because everything can impact your health and your well-being. And quite often people are surprised by what it is that I let them know that your body is conveying to me about what is causing stress or what is an underlying issue to the condition. So if you have any questions, you're welcome to get in touch with me as well. So you can contact me directly via my Facebook page, Kim Sheppard Health and Wellness. And Sheppard's SHEPPARD, because there are a few ways to spell it, but that should be the only Kim Sheppard Health and Wellness. And I do wish you well on your journey as well. Many women I've met have suffered for a long time with PCOS, and I have seen many women, they've gone and had a hysterectomy before coming to see me because their periods were that horrible. But I do have some women who come through who have heard of naturopathy, have heard of naturopaths, and come and see me to prevent the surgery as well. So if you do need support, please reach out. It is something that I work with women like this on a regular basis, and I want to show you how much of a blessing it can be to be a woman and to not have to feel that pain and discomfort every month. So I hope you all have a wonderful evening. I'm going to go put my pajamas on and head back downstairs, and I hope that you'll have a wonderful week. Good night, everybody.